Basic anatomy, micro and macro structure. Macrostructure focuses on large organs that have vital functions, such as the heart, kidneys, and lungs. Microstructure discusses small units such as neurons as the basic unit of the nervous system. Sarcomeres in muscles as the smallest unit of contraction. Microstructure and macrostructure refer to two different levels of analysis in studying the human body, especially in the context of anatomy. Both have different focuses in terms of size and how we examine body structures. 1. Macrostructure, macroscopic. Macro or macroscopic structure refers to parts of the body that can be seen with the naked eye, without the aid of tools such as microscopes. This includes large body parts such as organs, body systems, and tissues that we can identify directly. Macrostructure focus, size, structures that are large enough to be seen directly. Examples: organs such as the heart, lungs, liver, kidneys. Brain and body systems such as the cardiovascular, musculoskeletal, and digestive systems. Macroscopic structure examples: 1. Heart can be seen directly through physical examination or surgery. The size and shape of the heart can be easily observed by a doctor. 2. Lungs, organs that can be seen and examined in the context of the chest or thorax. Examination of the lungs can be done by auscultation, listening with a stethoscope, and X-ray examination. 3. Bones, long bone structures such as the femur or tibia, or large bone structures such as the skull can be seen and felt directly. 4. Abdomen, large organs such as the stomach, liver, and intestines can be studied in macroscopic anatomy by physical examination and dissection. Macrostructure study methods, dissection, involves cutting the body or body parts to see the internal structures with the naked eye. Physical examination involves palpation or direct examination of the patient's body to identify changes or abnormalities. Medical imaging, use of technology such as X-rays, MRI, or CT scans to view the overall body structure. 2. Microstructure, microscopic. Microstructure or microscopic refers to the parts of the body that can only be seen with the aid of a microscope. This includes cells, tissues, and body components that are much smaller than those visible to the naked eye. Microstructure focus, size, very small structures, usually in micrometers, micro-m. Examples: cells, muscle fibers, connective tissue, nervous tissue, and other cellular components. Examples of microscopic structures: 1. Cells. Cells are the basic units of life and have very small structures, can only be seen with a microscope. This includes body cells such as red blood cells, nerve cells, muscle cells, and epithelial cells. Each cell has organelles such as the cell nucleus, mitochondria, endoplasmic reticulum, and others that have special functions. 2. Tissue. Epithelial tissue consists of adjacent cells and forms a protective layer, such as those found on the surface of the skin, digestive tract, and blood vessels. Muscle tissue, such as skeletal muscle, can be seen through a microscope with regular muscle fibers, and smooth muscle, found in the walls of internal organs such as the stomach. Nervous tissue consists of neurons, nerve cells, that function to transmit nerve impulses. 3. Muscle fibers. Skeletal muscle fibers are composed of many myofibrils, which are visible only under a microscope. These microscopic structures are important in understanding muscle contraction. 4. Blood vessels. Blood vessels such as capillaries are small veins that are visible only under a microscope. Their microscopic structure is important in understanding blood flow and gas exchange. Microstructure study methods. Microscopy. Using a light microscope or electron microscope to observe body structures at the cellular and tissue levels. Histological staining. Staining of tissue is done so that cellular and tissue components can be seen more clearly under a microscope. Immunohistochemistry, a technique for detecting specific proteins in tissues or cells. Conclusion. Macrostructure focuses on organs and body systems that can be seen directly with the naked eye, while microstructure includes the smallest components such as cells and tissues that can only be seen with a microscope. Macrostructure studies are often used in clinical anatomy for diagnosis and treatment, while microstructure studies are essential in histology and cellular research to understand the internal functions of the body at a deeper level. Both are essential to providing a complete picture of how the human body functions, from the overall level to the smallest details.